I want to just recognize all of you and to thank all of you. I am profoundly grateful for what everyone has done.
Earlier here in British Columbia, but that we have flattened and leveled over the last few weeks. Since we put in place those public health measures that we're talking about, the safe distancing, the closing of schools, the working from home, the staying at home message, people in BC did follow that message. And we saw a dramatic decrease in people moving to workplaces, to transit, to retail and recreation facilities, and even to groceries and pharmacies. And we saw an increase in people staying near home. So we are on the right track, but we must hold that line. Together we have made good decisions, and we've made them at the right time, and people in BC have done the work that we need to do. It is essential that everybody in BC continue to practice what we have been doing, our physical distancing, for the near future.
It's really extraordinary, and we talked a lot about the actions in March. What happened in January and February in slowing the transmission of COVID-19 in BC, led by Dr. Henry, led by Mr. Brown, the preparations that were made in all our health authorities, from the regional health authorities to the First Nations health authorities, made an enormous difference at that time, and we have to recognize that.
The difference between what could have been and what actually happened here in BC is because of the measures that we took together, each of us individually and collectively. The social distancing, the social connectedness, the physical distancing that we took. The fact that we took it to heart that we needed to stay home and stay with our families and our households. The fact that we took it to heart to clean our hands, to make sure that we were cleaning our environment, to make sure that we stayed away from others if we were sick ourselves. Those were the things that have allowed us to bend that curve here in BC. This slowdown is due to our public health actions.
I know the Premier is, I know Dr. Henry is, I know everybody in our system is, and has been working so hard. The folks at the BC CDC who literally haven't had a day off in months because of their commitment. And for all of you, for all of your efforts, we have to. Being 100% all in may change, but we have to continue to be 100% all in together for the ones we love and for the ones we don't know.
Our goal as we move forward is to control the transmission and growth of any new cases of COVID-19 in our community. It's not going to be the same. Our new normal for the coming months, and it may be some time, is going to be modifications of what we're seeing right now.
Whatever actions we take, we know that there's a significant human cost if we get it wrong. The situation is complex, and it is without precedent in our lifetime.
And you know, this is not the end for us. It's not even the beginning of the end. All of the sacrifices that we have been making across BC for the last month and even longer will be for naught if we don't continue to take those measures now and thoughtfully and carefully open up as we are able to, and to make sure that we are monitoring carefully across the communities, across BC, to make sure that we don't end up having a surge that overwhelms our system in the coming weeks. And to quote Churchill, it is perhaps maybe the end of the beginning, but it is a thoughtful process that we need to continue for the coming weeks and months. Thank you for the efforts you're making to stay home, keep a safe distance from others, and protect our communities. What you do matters. You're helping to slow the spread of COVID-19. Please continue to help protect our loved ones, our elders, and our healthcare workers. And for children and youth, remember, this is not forever. This is just for now. Let's all be kind, be calm, and stay safe. Thank you for doing your part.